Hello, everyone. Thanks for joining us for the Art of Fixing Candida with Biological Medicine. My name is Heather Schofield, and I'm the Education Director and a homeopath here at Biomed. I've been working with Candida with clients for the last 15 years and also educating practitioners to be able to work with their patients from the biological medicine perspective. And here's Angela.
And my name is Angela Ford-Reimke. I'm the Education and Medical Support Specialist, and I've been working with Candida with clients for the past 10 years. And so, like Heather has stated before, we are really excited to share with you not only our knowledge about Candida, but the clinical pearls that we've been able to obtain and acquire from practitioners like yourself and some of the most influential biological medicine practitioners from Europe, from Canada, and the U.S. So we're really excited to have you join us today on the Art of Fixing Candida with a biological medicine approach. And without further ado, we're going to get right into talking about Candida, its role in the body, talking about biofilm, how that affects the body, the matrix, all of that in greater detail. And so I will pass it back to Heather.
All right. So let's get started. The role of Candida within the body. So there's over 81 different species of Candida, and Candida albicans is going to be one of the main ones that we're actually focusing on because Candida albicans tends to be the one that actually causes symptoms in the body. It can be very virulent, so it's symptom forming and very pathogenic. So with that one, understanding Candida albicans will really give you as a practitioner a leg up in being able to help patients with Candida symptoms. So Candida does actually have a beneficial role within the body. It's a naturally occurring yeast form of fungus. We're born with it. It is part of our normal flora in the mucous membranes of the mouth, the throat, the intestines, the vaginal mucosa, and the urogenital tract. When it's in its physiological or normal form, then it's just part of the flora and fauna. When things start to go out of balance, which we're going to detail very shortly, then it can start to move or shift into a pathogenic form, the mycelial form, and that's the form that causes symptoms. Candida does have that symbiotic role within the body, and so things that it helps with is aids in digestion and nutrient absorption. It binds heavy metals, specifically mercury, in the mouth and the gut, or so in the intestinal tract, and protects the tissues of that from mercury. It aids in decomposition of the body after death. It also aids in eating decomposing food and the fermented foods also within the body. And when we talk from the emotional perspective, because Angela and I always talk at least at some point about the emotional perspective, it helps to magnify this need for strengthening personal power. The morphology component, the pleomorphic morphologies, this is one of the very first things to understand about Candida and to understand why it can actually cause symptoms in the body, and then more importantly from that biological medicine perspective, why we actually don't want to kill it, because that's not necessarily going to be the way that you can treat it. Instead, we need to work with the body, we need to change the environment, and we need to be able to downregulate Candida back into its physiological form. So understanding pleomorphism or pleomorphic, it's the ability to change from one morphological form into another form. And all of this change is dependent on the environment of the body, the environmental conditions of the body. And so when we're talking about the environment of the body, we're talking about pH and inflammation and stresses and the flora and the fauna and the microbiome being out of balance. These are all components of this environment and as it changes. So Candida then, the Candida albicans, it's different morphologies. So in its physiological form, or this mutualistic symbiotic form that exists in healthy numbers within the body, it's in this budding yeast form. When the environment within the body starts to shift, and usually it's when the pH starts to go out of balance or becomes more acidic or more alkaline, depending on the tissue of the body, then you start to see that the Candida needs to adapt to that, and it starts creating these pseudo-hyphae, which look kind of like legs or roots that come on. So they're triggered by changes in flora and fauna, by immune changes and pH changes. And then it can finally move into this mycelial or hyphae phase, and this is the pathogenic form. There's some really cool images here, actually, that are done under the electron microscope. And so in the one image on the right, you can see there's this cluster, and it's got bud forms, it's got the pseudohyphae, it's got what's called the true hyphae, and then the mycele forms as well. And so they all cluster up, so they're not all kind of independent of each other. Once it gets into that mycele form, that's when it's pathogenic, and that's when it does cause symptoms. And it's not when you've got one kind of root, and roots as the hyphae, and it's usually where it's colonized and clustered where you tend to see the main symptoms in the body. So understanding these different stages in this pleomorphic component, the thing that is also super important to understand about it is that it can reverse back into the budding form. And so it changes depending on environment, and we need to keep the environment healthy in the body to keep that budding yeast form as the prevalent form. So the trigger for pleomorphic changes, we've mentioned them already a little bit, but you get these changes in the internal milieu, which is the environment of the gut and the tissues. They tend to become acidic. Friendly bacteria are killed off. Inflammation starts. The immune system becomes stressed. And all the watchmen that keep Candida in its budding form start to get stressed in the way that they can't keep dibs and tabs on Candida. So the Candida yeast genes, so it is genetic things, start to begin this pleomorphic change. And it starts to shift out of that yeast-like form into the pseudohyphae and the hyphae and mycele forms. And then you get these colonies of them, and then wherever these colonies reside, then you'll get resulting symptoms in that area. So that could be seeing thrush in the mouth. It could be in the intestinal system, candidiasis. For women, vaginal infections or yeast infections could be where these colonies are forming. So the point coming back, of course, because we're talking from the biological medicine perspective, is we need, instead of concentrating on killing the Candida, and that's usually what most treatments and therapies are trying to kill the mycele form, we can't just do that. We need to focus on converting the pathogenic pleomorphic forms back into their normal budding form, and we do have a solution and an ability to do that from Biomed with one of our Sanum remedies. And then we also have to think about the environment, that internal milieu and the pH, and we have to address it to be able to support that budding form to stay in that budding form. So those are the two things that Angela and I are going to be conveying tonight as far as the whole reasoning and understanding of biological medicine in regards to Candida. And this is where therapy is also going to be coming into play to be able to create these things to happen. So the last thing, I call Candida instinctually intelligent. I don't know if it's intelligent specifically, but it sure as heck likes to survive in the body. So 90% of newborns are born with this normal budding Candida in the gut. It's non-pathogenic and it's asymptomatic. So the majority of the population does have budding Candida albicans within the body. And so we already have it there showing it is part of our normal flora and fauna. However, when things start to change and Candida moves into this mycele pathogenic form, then it does what it can to actually survive. And so these are some of the things it does. When it's in its mycele form, when it's fed sugar, one cell increases to 100 in 24 hours. And then so by the fourth day, you have 100 million Candida mycele forms within the body or cells. So it multiplies rapidly. And how can you expect to kill all of that off with herbals and other things? Like it's, when you start to think about it, it becomes almost impossible. It uses adhesion proteins to bind to the mucous membranes. And so at the bottom there is a picture of its cell wall. And it has all kinds of stuff in there, including proteins and enzymes and chitin and polysaccharides and phospholipids. So there's a lot that goes within the Candida, and so it is able then to adapt, bind onto the mucous membrane, and so therefore it makes it harder to clear out of the body in general. So with the body trying to clear it out, it's harder. With digestion trying to clear it out, and then if you're using other types of remedies or natural products to clear it out, it becomes harder. When the mycele form feels threatened through medication, and that could be natural antimicrobials or pharmaceutical ones, it can use in its filament or roots, so those hyphae, and they go deeper into the mucosal tissue. So it burrows in, and then it secretes all kinds of stuff, including enzymes, which start to degrade and break that mucus down so it can tunnel in even deeper. And then this is one of the reasons that you get intestinal inflammation. It has this phenotypic switching that allows it to change the ability to adhere to different types of tissues in the body. It has up to 178 different antigens, so it can switch its antigen expression, so it makes it really tricky for the immune system to actually target it, and it can change its tissue affinity. And so if it burrows deeper into the intestinal mucous membranes and then even goes kind of through as a leaky gut into the tissues, it can actually survive this. And so it's very flexible in surviving. It has 79 different mycotoxins. These are the toxins or byproducts, toxic byproducts that are secreted from Candida albicans, and that damages tissue. And it can be absorbed into the blood in really immune-suppressed cases. It can compete with hormone receptor sites. So you can see that Candida can be an underlying cause for hypothyroidism, hyperestrogenism, and it can also bind to cortisol and progesterone for its own purposes, causing hormonal deficiencies and fluxes in the body. It's also linked in these situations to things like irritable bowel and gluten sensitivity and intolerance. It also produces and secretes alcohol and glycoproteins, which can stimulate mast cells to release histamine, so you get these allergic reactions, which again comes back to the gluten and also to the irritable bowel. And then finally, it secretes aldehyde. And if the liver is not able to process the aldehyde out of the body, then it affects the blood-brain barrier, and you can start to see more mental emotional symptoms like anxiety, depression, and memory issues. So, and this is just a tip of the iceberg of what Candida does in order to survive in the body. It secretes all kinds of stuff, hides from the immune system, and it becomes really tough for the body to be able to deal with the immune system or the antimicrobials, as I mentioned, whether they're natural or pharmaceutical. And it also can create some resistance to a whole bunch of the pharmaceutical antimicrobials and antifungals. And this is actually a big new thing that's kind of in the news, is these resistant strains. And so coming back to the whole biological medicine perspective, like, it's almost impossible to fight this. In a lot of ways, we need to work with it. And working with Candida, again, means understanding how it works and functions in the body, understanding how it changes from a pleomorphic perspective, and understanding how then working with the body and the body's internal environment and putting that back into regulation will allow us all to be able to help our clients and with ourselves get Candida back under control. Okay, so Angela's going to share some more on Candida and pleomorphism.
Okay, and as Heather was talking about from the pleomorphic shifts and switches, when you look at Candida from its mutualistic form to its compensatory form to the pathogenic form, it is that pleomorphic valent form, so it keeps going higher and higher in valences. So you see in this diagram, you see its resistant low form, and then you see the homeostasis form, and you see the trauma, the dysbiosis. And the reason that we're looking at this progression, the underlying component of this progression has to do with biofilm. So biofilm is a big component that has to deal with Candida, and why Candida is such a tough organism to try and take the kill approach, which is why we're wanting to shift and do more of that downregulation, the pleomorphic, in a symbiotic sort of dance, if you will, because Candida has a certain architecture, biofilm has a certain architecture, so we need to work within that framework. So which this pleomorphic shift brings us into biofilm. So I'm going to go into a bit more details on biofilm and really talk about how biofilm is such a crucial component in understanding Candida. All right, so what is biofilm and what is the connection with Candida? First, in order for us to really understand its connection, we need to understand what biofilm is as a defense mechanism, as a protective mechanism. So several studies have shown that more than 80% of human beneficial bacterial infections are associated with bacterial biofilm. So when we think of bacterial biofilm, the body, we have to recognize and understand that the majority of microbes live in this very complex community, and this community is called biofilm. So in biofilms, the individual cells, they're held together in this self-produced extracellular polymatrix. And these are often most likely comprised of polysaccharides, proteins, DNA, calcium, magnesium, iron, mucus. What's really interesting about biofilm and why it's like Candida is so intelligent from that perspective is that it creates this biofilm around itself as a protective mechanism, and it itself becomes its own microcosm, and it becomes its own sort of entity, its own sort of environment within the environment. So it builds this mechanism, this barrier around itself, when it senses this negative living condition or an outright attack against it. So it does this because it needs to evade the immune system and antimicrobials, antibiotics in that component. And why is this important? Because the physical barrier that is biofilm, this is what keeps most of the immune system from detecting this pathogenic form of bacteria. That's why the kill approach doesn't work, because the more that we try to kill Candida, the greater and thicker its biofilm becomes. So in order for Candida to form a biofilm, one of the first things that it does is it adheres to and sticks to the surface, and then it generates this massive polysaccharide matrix. And when you think about it, it's quite intelligent because it's recruiting all these materials and all these components, and it's bringing it into its infrastructure. And that's how we see this evolvement of this architecture that is the structure that's protecting it. So once that's built, then it collects other materials in the body, and builds this mucus-like gel. And this coating around it is what really kind of keeps it kind of like a gel tacky substance. So even when the immune system tries to get in, it sticks and it's like propelled away. And the other really smart thing about Candida when it comes to biofilm is it adds fibrin. So fibrin it's a protein fiber in the body that it acts as this type of rebar to the body, or a mesh-like substance to hold everything together. And then it winds it tightly. It just pulls it tightly, and it creates this form, which it's known as the biofilm cyst. So it makes it really, really difficult for antimicrobials, any kind of medication and drug to permeate that. So as much as we look at Candida in an upregulated form as this, horrible pathogen, and the biofilm as this, Fort Knox wall, when we look at it from a biological medicine perspective, it's actually quite brilliant in that it instinctually knows that when it's been attacked, it needs to protect itself, and it creates barrier upon barrier upon barrier to really secure this hold. And then so this biofilm-resistant barrier is why Candida albicans is one of the hardest Candida organism to try to kill. This Candida albicans organism is so instinctual, it's so smart that it also recruits the Staphylococcus aureus, because together they pose a serious complication to the matrix of the body. So because the staph then is able to adhere and stick to the extracellular matrix protein of the body, so that when we talk about the environment, the terrain, we need to get the pH and balance that, because keeping the pH balance actually will allow the body to start breaking down and permeate the biofilm, and it allows the body to sort of disrupt biofilm, if you will. And I'm going to get into a bit more details about biofilm disruptors. So when Candida and the Staph aureus combine, the key mechanism in when they combine, if you look at it, looks like these little like spikes around them. These spikes around them are actually fibrin. So they recruit fibrin, and they create another layer of extracellular matrix around them. And they're using materials from the body that's already existed. That's why they're so intelligent. Like, I have this weird innate admiration for Candida albicans and Staph aureus from the intelligence of these species. And I think as practitioners, we need to also realize that they are intelligent, and as Heather stated before, we need to work with them. And that's why the biological medicine pleomorphic approach really, really works. And so I digress, to come back to the matrix that it creates with this beautiful fibrin formation in the body utilizing blood and this extracellular matrix that it builds. That's how it's really able to resist any sort of antibiotic or antimicrobial, because this creates that ideal defense mechanism against the immune system, immune cells, and therefore antibiotic therapies are not as effective because they can't penetrate this wall. They can't penetrate this this amazing barrier that's presented, that is built up. And this is all about a survival mechanism. Just like the immune system is designed to help to help the body, Candida is just doing the same thing. It's trying to protect itself and help its form. And so now I'm going to shift into biofilm disruptors. So there are a few main proteolytic and mucolytic enzymes that really a lot of research has been showing that these particular enzymes are major components that help to disrupt biofilm. So the big mucolytic enzyme that really helps to break down and disrupt biofilm is serrapeptase. So I'm going to actually go into serrapeptase much later. So then we have enzymes that actually break down fibrin itself. If you remember earlier, I was talking about how biofilm, they actually recruit fibrin. So the two major fibrolytic enzymes that actually break down this mesh, this cyst, is nitrokinase and lumbar kinase. And third, which is really important, that all elements of this has to be administered for the body to really break down that biofilm to get to Candida. And the last is binding of the biotoxins, and chlorella is the organism, the algae, to really do that. And this also leads into the heavy metal components, mercury in particular, and biofilm loves mercury. So again, I'm going to go into more details about that, each of these specific mechanisms, the disruptors, the fibrin dysregulator, and the actual binder, because we need all of these in order to break up fibrin, in order to break down biofilm, so that the actual down regulation of Candida happens and we bring it out of the mucous membrane. All right, and most of you probably have heard of Dr. Klinghardt, and Dr. Klinghardt, one of the things that he's always taught, especially from a biological medicine perspective, is when you're looking at mercury and biofilm, he always stresses that mercury load and biofilm go hand in hand. So in order for you to remove mercury from the body, you also have to address biofilm, because they go hand in hand, and Candida, that's the perfect environment. And then Dr. Rao, he is the other biological medicine guru. Dr. Rao always talked about Candida in its various valent form, and so the milieu, the terrain, is going to determine the valent forms of Candida. So with a higher heavy metal burden, with a higher mercury toxic load, you're going to find that Candida, as Heather stated earlier, stays into that mycelium form, into that budding, into that cluster, and we're wanting to shift them back into the budding form, the more symbiotic component, if you will. And so some of the ways that, as practitioners, you can check to see the different valent form that your patients the Candida is presenting itself is through the stool analysis to confirm Candida. And also, you want to check with patients that have amalgams, because if they do have amalgams and they're having Candida issue, you can safely assume that those are connected. And the more amalgams that a patient has, the higher the mercury load in the body. So it's important even when you're doing a heavy metal protocol, that your patients, they have the amalgams removed, because in order for you to properly mobilize metals, and especially amalgams, you can't have the heavy metals in, they can't have any amalgams in. So that's kind of a first line you could use with getting the testing done and making sure that amalgams are removed, and then start the actual binding and reducing the burden load.
All right, so let's start talking about what actually causes Candida overgrowth in the body. We've talked about the fact that there's biofilm involved, and that there's heavy metals, including mercury, involved, and that there's pH that goes out of balance. And so what is kind of the process? So again, Candida populations, they're naturally kept under control in the body through healthy intestinal flora and the immune system. Overgrowth will start to occur when the flora becomes altered, and this can be done through the diet. So refined carbohydrates, high proteins, too much protein the body can't process, sugars, alcohol consumption, lots of stress in life, antibiotic or antifungal medication use, oral contraceptive and steroid medication use, and an increased heavy metal load. With all of this said, one of the things, I read this really interesting article about Candida last week, and it was kind of an anti-Candida article, and I thought, it's interesting to read both sides of the story, because there are a large population of medical practitioners out there that don't really understand or acknowledge Candida to be a problem. And so it was, this one author was saying that not only are these alternative practitioners diagnosing people with Candida, which he didn't really believe in, he said they're also blaming them for causing it themselves. And I thought, oh, isn't that actually an interesting point? Because we do talk about this, like, through the diet. So if you eat too many carbohydrates, or you eat too many sugary snacks, or you drink alcohol, or you are stressed out, or you've taken oral contraceptives so that you choose when you get pregnant, and or you have different issues going on. And so one thing to kind of say, and I definitely, after I read that article, wanted to make sure to say that this is definitely not a blame game. Instead, it's the understanding that these types of things, which in our lifestyle and in kind of our North American way of living, these are all part of our day-to-day life and our social groups and kind of how we deal with things, even to some degree. The big point in all of this, though, is that all of these types of things are potentially acid-forming. And so this is why 80% plus patients or clients or, the population tends to be acidic or acid-base imbalance. And these are all contributing factors, which are often daily factors for people. So it's not so much that we've done it ourselves. It's more about the lifestyle and the environment we live in and kind of being in this North American lifestyle that does promote this more acidic type terrain or acid-base imbalances in the different tissues. And so what we need to do is then make sure that we are able to reverse it using alkalizers, and also making sure we're taking care of stress and decreasing stress and eating really healthy food to then say, hey, we can still drink wine and we still can eat steak and, have that donut when we feel like it, but we've got it all balanced out, because it's always back into regulation and balance. However, with all that said, these are all factors that contribute to causing acid-base balance in the body and causing the flora and fauna to go out of balance and stressing the immune system. And this is all what kind of keeps the Candida populations at bay. So when the internal environment changes, potentially due to these factors, then you start to see acid-base imbalance, you start to see inflammation, the flora starts changing, the immune system weakens, and then the Candida can start to shift out of that bud form into the more pathogenic form, causing symptoms. Okay, so then types of symptoms. The list is not exhaustive. You can continue on and on with this list, but types of things. And things also we'll talk about after. What are the practical things? So gas and bloating, intestinal disturbances. It could be diarrhea, constipation, irritable bowel, a leaky gut, foggy brain, brain fog, sugar cravings, fruit intolerance, allergies, hives, itchy ears, autonomic nervous system dysfunctions or disturbances, autoimmune conditions, especially Hashimoto's, ulcerative colitis, yeast, vaginal yeast infections, urinary tract infections, lots of itching, vaginal or anal itching, bladder infections, fatigue and brain fog, depression, mood swings, nail fungus, specifically nail fungus. Nail fungus, you have to never forget about Candida, and we've got a good protocol for you so that you can help that person get over the nail fungus, which is tough to get over, but not necessarily with what we have to offer. So skin issues, rashes, athlete's foot, jock itch, fibromyalgia, chronic fatigue, they all kind of match in. And again, this comes back to when we're talking about Candida being intrinsically and instinctually intelligent. A lot of what it's secreting as those toxic byproducts are hitting a lot of what's causing these types of symptoms. And so again, getting the Candida back under control will help with a lot of these symptoms, getting them also back under control as well. Okay, so the types of things, like if you're just working kind of in clinic, working on symptoms, the types of things that are easy to observe in clinic with patients is, number one, to ask about gas and bloating. And some people do have it. So then the next thing you have to start asking about is what kind of foods are they eating, if they eat raw vegetables, or if they eat something with lots of cellulose, or beans and legumes, do they tend to get a lot of gas and bloating? How smelly is their gas? Do they have any rashes, rashes for women under the breasts, also anybody in the armpits, and kind of crooks and where extra skin is? That's where Candida can like to hang out. Nail fungus, you tend to see these hardening, yellowed, brittle, thick nails. That's an indicator of nail fungus. And then other kinds of skin rashing type things, fatigue, and then the tongue. And the white coating on the tongue. And so my first questions usually are to ask somebody to stick their tongue out, to take a look at their tongue and to see if there's any coating on their tongue, and then also ask about gas and bloating with meals or with food. And those can be some early indicators that maybe it's something you need to look further into. Okay, and so then also for those of you that do practice constitutional medicine or homeopathy or based on biological medicine from a constitutional perspective, there is a Candida constitution. And so just understanding constitution is really about an individual and it determining what type of disease patterns they express within the body. And so the Candida constitution type, they tend to express fungal conditions, dysbiosis, mycotic type things. So these are symptoms that are associated with Candida, of course, and rashes and mucous membrane issues, candidiasis, yeast infections, digestive issues. So again, kind of a lot of those main Candida symptoms. So there are some people that are going to be more prone than not, specifically to these types of conditions. And they'll get better, but then they're going to have to definitely watch their lifestyle components so that they don't revert back. To keep that Candida, they need to keep the Candida in the healthy form. The types of testing, there's a lot of different testing out there. Patient history and symptoms are one kind of quick and easy way to just be working with people. There's a Candida questionnaire. There's lots of different ones. Dr. Crook's Candida questionnaire is the one that Dr. George Giorgio, who's a naturopath and biological medicine practitioner, he recommends this one. So we can get a copy and send that to you in the follow-up email. You can do blood tests for Candida antibodies. However, they may or may not be positive or negative. Stool testing, this is going to allow you to figure out if there's Candida in the lower intestine and colon. Use the comprehensive stool analysis. And what they're able to do is determine what species are in the stool or essentially in the body, and then also looking at some other effective treatments like caprylic acid or oregano. Doctor's Data does a really excellent comprehensive stool analysis that gives you really great details and some ideas of what to use as far as kind of the antimicrobials in your initial stages of clearing things out. The urine organics dysbiosis test, it looks for waste products from Candida overgrowth. And then there's also the spit test. I don't know if the spit test is super accurate or not, but I've heard lots of people using it, and it's really easy. So it's something you can do in clinic or have people do at home. Basically, you spit first thing in the morning and then check every 15 minutes for an hour, and just to see if the saliva grows legs and or if it becomes cloudy and if it's sinking or if it's floating and if it remains clear or if it gets cloudy. And all of these things then will give you an indicator as far as potential Candida dysbiosis. And that, is easy one to do at home. I have done it myself just to kind of test it out when we were first doing these presentations, and so I won't tell you my results, though. Okay. And so then from the emotional perspective, again, as I mentioned at the very beginning, Angela and I, this is one part of medicine that we always incorporate in everything that we're doing. And so Candida does have an actual picture to it. The root of Candida really it's not about what you're eating. It's more of a window into your emotional needs. And so what I'll do is I'll pass it on for Angela so she can continue to talk about the emotional healing from Candida overgrowth.
And as Heather was saying with the Candida constitution type, so you'll tend to see more of an emotional and dysregulation with that constitution type. I mean, it's not just isolated to that constitution type. You'll see an emotional picture with any patient that comes into your clinic, your practice that has some kind of Candida picture, Candida symptoms and so these are just a few questions that you as a practitioner can ask just as a probing to get a picture, if you will, for example, asking your patients, do they feel when they're angry or when they're sad, do they find that their emotions expand or do they find that they suppress it? So both answers are actually going to give you a Candida picture, because even with that client that's releasing that emotion, remember it's still part of that matrix. It's still part of that DNA. And as I was talking about the biofilm, that also locks emotions into the matrix. It's part of that epigenetics, if you will. So a lot of patients that hang on to that feeling of shame, guilt, anger, and in particular that victim energy, it creates this cycle. As Dr. Enderlein, from a biological medicine perspective, talks about the bacterial cyclogeny and the valent forms of pleomorphic organisms, the same thing is applicable to our emotions. You get that emotional cyclogeny that happens as there is an upregulation of emotions that happen, and so the higher that valent form is of the emotion, the greater the Candida picture will also be in that patient. So from that releasing the victim sort of energy from a Candida picture, asking your patients about frustration, asking about feeling of helplessness, overburden, struggle to find balance in oneself, untrusting, distress in their relationships. And also for those of you practitioners that do rubomeds, you'll see this picture showing up in Shivita 3. So that third chakra, the solar plexus, that's all about processing their environment, assimilating, and then releasing. So you'll see some emotional blockage in Shivita 3. You'll see some Candida picture with that too. So for those of you who do the Rubomed remedies, that do the psychosomatic energetics, this is something for you to keep in mind as far as when you're also dissolving emotional conflicts with patients and clients. Candida is something that should be in the peripheral as well. So from a greater emotional component, helping your patients to heal on an emotional level is also fundamental in helping them to downregulate Candida. And the reality is we have two pictures of disruption in the milieu and terrain. You have the actual physiological disruption, the acidity level. The other picture of the scale is the emotional disruption. which also acidifies the body, and more importantly, seals and locks into the cellular matrix. That's that epigenetics. So it's important to address not just the physiological symptoms, the Candida picture in its physiological form, also address that emotional picture because it goes hand in hand. So healing Candida is a journey of self-awareness and empowerment beyond just taking remedies. It's also working on that inner balance with oneself, trusting one's self, and really having a balance in life and a balance in how they see themselves in the world, in the environment. All right. Okay, so Heather is going to go into more details on the whole components of the system of bringing down Candida, addressing Candida in the different levels, and this whole program that we're talking to you about today.
All right, so let's start bringing all of this together. I love kind of working with talking about the details and educating about Candida. I know Angela loves doing that too, and Biofilm, like she's becoming this Biofilm expert. Seriously, if you've got questions, get in touch with her because she'll be able to answer your questions. And if she can't, she knows how to research the information and get it to you in more than you would ever imagine, higher expectations than ever before. So then bringing it all together then, so we can turn all of this information into practical use, we want to reduce, rebalance, replenish, and that's kind of the whole key. When we talk about Candida at Biomed from the biological medicine perspective, it's always about reduce, replenish, and rebalance as our principles. And we can do this in a few different phases. So it's one thing to be able to take some probiotics and maybe to do some pH work, but there's a lot more to think about, and this is what we've been talking about tonight. And so the Candida mercury biofilm component, all of those things do need to be addressed for successful long-term getting Candida back into its physiological form. And so that is kind of working in this phase 2 and phase 3 section. But what we want to do is first get into phase 1. And so phase 1 is 2 big components. Number 1, we want to make sure that the digestive system is working, so we've got a healthy digestive tract, and that is making sure that things are moving properly, that the flora and the fauna are doing really well, so microflora, microfauna, so probiotics. We want to make sure that there's no constipation and that the bowels are moving well. And generally, we want to be supporting with things like digestive enzymes and just making sure overall digestion is doing well. We also need to detox. And so this is where that biological medicine and homotoxicology component comes into play and why it's really actually important to think about. Patients who have done detoxing, especially liver, kidney, lymphatic, and gut detoxing, generally tend to do better overall when you're working at other things, like Candida, for example, or emotional detoxing. And so with the detoxing, why it's actually so important when we're talking with Candida is we need to make sure that the detox pathways are open. We need to make sure that the bowels are moving well, that the liver is working optimally, that the kidneys are also working, that the lymph is moving. And the reason is when the detox pathways are open, then when you start actually clearing out Candida, you are going to have a better ability to do it in a less symptomatic healing crisis kind of way. And this is one of the big things that I know that patients go through when they're doing Candida cleanses is they can go through Herx reactions, they can go through all kinds of healing crises, and in some ways it can put them into jeopardy in the sense that it becomes really uncomfortable and sometimes they're not able to do it. And partially that's a big indicator that the body needs to do some detoxing to get those pathways open to be able to handle clearing things out. It's one thing to clear out Candida. It's another thing to clear out Candida that's bound up with mercury, and you're getting a release of mercury, and then your body's like, what the heck am I supposed to do with this if there's no way to bind it back up? And so having your detox pathways open is going to allow for this process to be smoother. In addition to that, one of the things I mentioned, again, of course, when Candida is being instinctually intelligent, is that it secretes do I have it in here? I thought that I did. It secretes different, maybe I put it somewhere else. Okay, sorry, I digress. It ends up secreting different things which the liver, if the liver's not able to handle the load, okay, so yes, let me come back to that. When it secretes acetaldehyde, if the liver's not able to process this, then again, you're getting different symptoms with it. So again, kind of clearing things out, you need the liver specifically to be working. So phase 1 is all about making sure detox pathways are open and making sure that the digestive system is starting to be worked on, so you're getting a nice, healthy digestion that can handle the detoxing as well. And then you start to move into the phase 2 section, where you're looking at starting to reduce, replenish, and rebalance. Replenish is very simple. It's really about replenishing intestinal flora, so taking probiotics. And we recommend to take lots of different strains. Not always the same strain over and over again. That's the beauty with probiotics 7-in-1. It's got 7 strains in one. We want to rebalance pH levels with acid-base balance and with nice alkaline foods and de-stressing. We want to support the immune system. Again, the flora is going to really help. Interestingly enough, when you're doing acid-base balance, you're not just looking at pH levels, but by getting things rebalanced in the different tissues for their ideal pH ranges, the immunity actually improves as well. And we can never forget the fact that there is a huge component of their immune system in our actual gut. And so we need to come back to healthy digestion, which is going to support a strong immune system. And then finally, reduce Candida levels, downregulate it using a very specific remedy we'll talk about in a minute. And then we also are reducing mercury load in the body and being able to bind it and get it out. And we're reducing biofilm, as Angela talked about, with some different techniques as those biofilm disruptors. Okay, so and then how do we do all this?
So again, we've stressed about the whole biological medicine approach, and that's really fundamental in this whole system, this whole getting Candida back into a symbiotic form and breaking down biofilm. The mucous membrane is a big component. That's why Candida burrows in the mucous membrane. So that's one of the reasons why that whole kill approach doesn't work, because the more that Candida feels threatened and feels that it's in danger, the deeper it burrows into the mucous membrane, and it disrupts that. As we know, the mucous membrane is the our major defense system, protective barrier. So that's why acid-base balance is important. Pyrus patches, really important. And some of you who do know the Sanum remedies, a beautiful Pyrus patches remedy that we have is Pleomorphic. Absolutely amazing remedy. Not part of this program, but just as a side, definitely, if you're addressing the gut, definitely take a look at Pleomorphic. And then lastly, the bacterial lining. So it's important to really fix and build that back up, repair that, because when we look at the GI truly it's an ideal environment from bacteria, and not just bacteria. We're talking fungal organisms, bacterial organisms, and again, these are all associated with biofilm, because the GI lining really has a really big, a huge surface area, and because of this constant influx of nutrients and microorganisms, this environment has to be stable. It really is important, and so for protection, so the GI's epithelial lining, again, that bacterial lining is really important, because that's why it's lined with this very viscous, elastic mucus. It serves a purpose. And so when this is damaged, you can see it in patients with excessive inflammation. They have that IBS symptom, IBD, and other sort of chronic conditions. So when this inflammation is persistent, Candida has a field day, so it's important to reduce that inflammatory process. And because this creates this opportunity for bacteria to attach to the surface, and again, you get this vicious cycle that happens, and this, again, begins that whole biofilm construction. So it's important to repair the bacterial lining, specifically the epithelial lining. So because this is what's often damaged. And as Heather stated earlier, you get that leaky gut picture. So this is really, really a key component of the biological medicine approach to really downregulating Candida. So if you repair that lining, you coax Candida out of the mucous membrane, you drain the mucous membrane, you can really start repairing these cell walls, these bacterial lining, the gut lining. And because of it, then you have a better handle in helping to focus your downregulation systematic approach when it comes to Candida. So because Candida, again, we can't stress enough, it's in its healthy form is very beneficial to the gut. And so that's what our aim is to bring it back down into that healthy system. And so we're going to talk a little bit more about the restorative Candida diet. So Heather's going to cover components. And so one of the things that I want to really stress in terms of the restorative diet is digestive enzymes. It's really important that you give your patients digestive enzymes. And more specifically, coconut oil. I'm not just talking about coconut oil, is the actual form and the natural production in coconut oil is the caprylic acid and lauric acid. So this helps to actually inhibit the development of biofilm. So because in itself creates a coating as well, and because of that coating, biofilm can't actually form. It's almost like it slides off. So it's important to also include that. MCT oil will do that too. So those medium chain triglycerides, it's important to include that in the restorative Candida diet.
Okay, and so some other principles in this restorative Candida diet, and this follows very closely along with the whole restorative diet from Dr. Wertman and Dr. Rao, and again, back to this whole biological medicine approach, is generally this diet tends to be lower in protein, and so low protein, that's not probably even the right term. The ideal amount of protein, the body can process 40 to 60 grams of protein a day in a 24-hour period, and anything above that will just end up creating acidity and putrefaction in the body. The body just can't actually process it. And so maximum 60 grams of protein a day, mostly plant-sourced, is ideal. And if you're thinking about meat serving, nothing larger than the palm of your hand. The diet tends to be very alkaline in nature because the body, if you're looking kind of as a general overall, slightly alkaline. Mind you, there's, of course, lots of acidic tissues that's their ranges, like the stomach, for example. But the intestinal tract tends to be kind of in a neutral, slightly alkaline space, and that's ideal for keeping Candida in its physiological form as well. Lots of raw food if the body can actually handle it. So again, coming back to that phase one of making sure there's healthy digestion and strong digestion, there's no sense in eating raw foods if your body can't actually digest it, and then you're getting a lot of bloating and gas because and fermentation of those foods, because then that's going to feed an unhealthy Candida population. But with the raw component, if you can digest it, then the high cellulose and fiber helps to support the healthy microflora. So that's super important. And it also helps keep Candida, it keeps the Candida in the gut. It helps to keep Candida from converting into the pathogenic forms. And it also creates bulk to be able to move things and clear things out. So if you can't handle, or patients can't handle eating raw food or initially, then have the veggies and fruits cooked. And making applesauce, for example, if somebody wants to eat an apple. Keeping everything below noon or earlier than noon for eating, and taking a digestive enzyme. We have an excellent digestive enzyme that does have components in it to break down cellulose and fiber and pectin and the bean and legume bonds. So that a digestive enzyme that's focused in there can also really help support healthy digestion, especially when dealing with Candida. This diet also tends to be allergen-free, specifically cow dairy, because it can cause a lot of congestion, inflammation, and impair the immune system or put a bigger strain on the immune system. And we're trying to repair the immune system, not strain it and stress it more. So basically, by removing potential allergens or acidifying food from the diet, the intestines are able to heal, the mucus lining is able to heal and become more robust. It supports the healthy bacterial flora and the Peyer's patches, which Angela just talked about in that really cool diagram. Also high in omega-3 essential fatty acids. This is also really important because it helps enhance these cell membranes, which is good for kind of all the cells in the body, and helping with neural transmissions, keeping tissues oxygenated, and again, supporting healthy flora. When we have a good combination of healthy flora in the gut, they will tend to manufacture their own omega-3s and 6s in the gut as well. So we want to keep them healthy to continue to promote these healthy oils. Okay, and then a note on a starved diet, because this is probably one of the hardest things that people try to do for 3 months, and they're not always very successful, or there's a lot of rebounding that happens afterwards. And so a starved diet is cutting out all carbohydrates and all sugars and fermented foods and yeasts and mushrooms and alcohol and vinegars. And so again, when we're talking from the biological medicine perspective and understanding Candida and working with Candida and shifting the environment in the body to support healthy Candida, we don't necessarily need to starve out the Candida. And we also have to remember carbohydrates, especially complex carbohydrates, they're not the bad guy. We actually need them in a Candida diet. We just need to be smart about what ones are being chosen. Candida is a sugar consumer, and so starving Candida or fungus will push it into its more pathogenic form. It will drive it deeper into the tissues to feed off glucose from the capillary beds, and we don't want Candida driven deeper into the tissues. We want to keep it in the gut so we can actually deal with it and get it into its physiological form. So complex carbohydrates, especially raw foods, again, back to the cellulose and fiber, they're ideal. It feeds the Candida and beneficial flora, keeps Candida in the intestinal tract, which I mentioned, so we can actually do the work to downregulate it in there. It helps accelerate elimination. It helps eliminate heavy metals, cooked veggies, to reduce gas and bloating, add digestive enzymes to break down the cellulose, pectin, and carbs, and avoid starchy and high sugar veggies. So stick with greens and stick with the less sweet of the vegetables. So basically, sweet potatoes, while they're great in this situation, they may not be part of it. And they're also a starchy vegetable as well. And some fruits, like apples, again, super high in cellulose and fiber. So apples are ideal. Berries are ideal, pears are ideal. There's some sweeter fruits that maybe are not so ideal. I do have a patient, and we worked really hard in the very early days with Candida, and by doing some very simple diet changes and working with Pleomorphic, she had changes happen within a week. And before that, she was dealing with, after dinner, being so bloated she looked pregnant. 9 months pregnant. And so it was really just with making some simple changes and some targeted remedies. And one of the things is she absolutely loves apples. And so on our second visit, as she was doing so well, I told her to add apples back, and you should have seen how happy she was. And it's kind of nice to say, hey, you don't need to remove your most favorite food in the entire world. So okay, so Angela's going to now talk about, again, this pleomorphic kind of biofilm relation with Candida albicans and Candida parsilosis, and then we're going to start to actually talk about specific solutions for these.
All right. So two of the most common Candida species and organisms are the albicans and parsilosis. And while they may be similar in their look, they're actually quite unique in their different morphology and valent forms. Albicans is the more aggressive of the Candida organisms, and albicans recruits a lot more raw materials from the body to create its biofilm, whereas parsilosis doesn't have the same bang, if you will, that albicans does. It's kind of like albicans is your starting line, and parsilosis is the backup or the second string. So just to kind of give you that picture. Nonetheless, these two particular forms of Candida does exist in the body, so often when you're addressing one, you're also going to be addressing the other. If you're addressing going to be addressing paracelsus. And we've got a couple of really great sound remedies that will really take care of these two forms of Candida. And with that said, Candida albicans as a remedy will also address the other, the glabrata and the Tropicalis. It will actually downregulate that form as well. So the main Candida paracelsus remedy is Pleopef. So those of you that utilize the Sanum remedies and are familiar with the biological remedies, PEF is definitely one that you should have in your repertoire when you're dealing with any kind of fungal, yeast picture. And PEF is quite a unique Candida remedy because we're looking more of the mycosis infection of the skin. The more the superficial orifices of the body, PEF really shines. And PEF is also a more gentle Candida remedy. So if you're finding you have patients that are very sensitive, PEF will often be the one to start on first. And so PEF really works really well with kids with cradle cap. If you have new moms, new babies, PEF is definitely one to use on them, and it comes in many forms: drops, suppositories, ointment. Definitely have PEF as part of a repertoire.
Okay, and then we've got Candida albicans, and so this is the remedy Pleoalb. And just to make a note, these remedies are classified as isopathic remedies, and so they don't contain specifically Candida albicans or Candida parcellosis, but rather in a 5X form. And so therefore it's helping to influence this downregulation that happens when you're dealing with these in their virulent upregulated forms. So Pleoalb, it tends to be for when the Candida albicans, but also when it's become more what's systemic and chronic within the system. And so if you're seeing nail fungus, it's not just hanging out on the nails. It's a bigger indicator that there is a deeper Candida problem within the entire body. And Pleoalb is the one that's going to help take care of that. And so Candida, fungal overgrowth, GI symptoms, gas, bloating, nail fungus, athlete's foot, groin itch, vaginal yeast infections, urinary tract infections, rashes, they're all in this Candida albicans picture. And then, of course, we'll be talking about mercury and mercury detox with all of that as well. So it comes in a number of forms, and I want to just detail all of those just so you have an idea of the spectrum of what you can be doing with patients. And so there are the drops, which are great for oral use, and this is one of the remedies that is in most of the protocols that is available, including the program that we're going to be talking about and also the Candida Fix Kit. And the typical dosing is 5 to 10 drops daily. There's also ointment that can be used on the skin for any rashes and then also on the nails for nail fungus. And it works like a natural antifungal. And then you've got the suppositories, which are great for vaginal yeast infections and urinary tract infections and bladder infections. And then you can also use them rectally for addressing systemic yeast infections as well, or kind of just working overall systemically. And generally use one suppository before bed. The nice thing to mention about the Candida Pleoalb remedy suppository is I know we talk like deep biological medicine, there's lots of protocols, there's lots of things to consider about changing the environment, but if you've got a patient who is susceptible to yeast infections, rather than keeping kind of the over-the-counter antifungals in their medicine cabinet, have them keep a box of Pleoalb suppositories, and they can use one, and one will usually just take care of the whole thing before it starts, or if they're in the middle of an infection, then they can use one usually once a night for 3 to 5 nights, and that will actually take care of the symptoms, but it'll be working better within the body to downregulate it, so less prone overall to kind of have these chronic infections. So while we do talk in depth with protocols, also remember you can use these as one-offs. The ointment can be rubbed on the skin for a rash, and the rash would go away as well. But if you want to get to the deeper root, then that's when you really want to address all that work kind of deeper within the body.
All right. So I know we talked about biofilm and now the actual remedies to help to break down biofilm. So serrapeptase is a big one. A lot of studies have shown that serrapeptase really helps to break down biofilm and break down, specifically it actually helps to drain the mucous membrane. It's a proteolytic and a mucolytic enzyme. So also great for allergies because you're reducing and you're draining that inflammation in the mucous membrane. And when you think about serrapeptase, originally it's found in silkworms. And what's really unique about silkworms is they use this enzyme to dissolve their protective cocoon. So the winged creature are able to emerge and fly away, which is why serrapeptase is this powerful mucolytic enzyme because it uses that same enzyme to dissolve that cocoon. It helps to dissolve biofilm. So that's serrapeptase is definitely a remedy. If you haven't used it, you need to definitely try it out, not just from a biofilm perspective, but for an allergy perspective too, to drain the mucous membrane. And it also helps to dissolve part of the fibrin, not as much as nattokinase, but a little bit because it really removes the plaster walls in the capillaries. So again, serrapeptase is a really, really great biofilm because it breaks down that coating. It clears the coating that microbes as sort of created. And because it does that, it reduces inflammation and helps to clear mucus from the lungs. So again, for allergies. And another really unique, cool thing about serrapeptase to keep in mind is serrapeptase even crosses the blood-brain barrier. So this is why it's important for disease and co-infections. So, and one of its most profound benefit is the ability to block the release of pain-inducing amines from inflamed tissues. So again, something to keep in mind. Next is nattokinase. Again, nattokinase is more fibrolytic, so it actually breaks down the fibrin, that mesh, that network, that biocyst. And nattokinase is really, it's quite unique in helping to reduce and break down coating on implants as well. And because it breaks down the coating, it breaks down the actual fibrin that biofilm recruits to create this plaster. Nattokinase is actually another unique enzyme to include in microbial parasitic protocol because they create this really nice defense mechanism. And so specifically with mold and parasites, you'll see a lot of this, like this mesh defense mechanism. Nattokinase is something to use when you're working with parasitic protocols as well. And then last but not least is chlorella. Chlorella, you need that when you're dealing with heavy metals, which is also connected with Candida. So chlorella is really unique because it's a binder. You need chlorella to bind the biotoxin and the mercury in the mucous membrane that biofilm produces. So all heavy metal toxic load, you really need chlorella. Chlorella is a really unique biofilm disruptor because its binder has this really amazing job of really, it sort of captures and mobilizes biofilm, and not just in the body, but specifically in the intestinal tract. And it does this, and it prevents any sort of reabsorption that could happen with the release. So chlorella is a really good one, and it's a complete protein as well. It's an algae base. It has the amino acid profiles. So it's quite a beautiful, beautiful remedy to have on hand. And one of the things to remember, once you've actually mobilized these biotoxins and once biofilm has been destabilized and the microbes are treated, it's important that you clean up that mess. So that's why chlorella comes in. And then the other thing too, you can use EDTA to disrupt the biofilm and also use that to help chelate the minerals. Again, chlorella is a more gentle option to do because of its mechanism. Really, really heavy metal. It works really fast. It works well, and it helps to release the stress and the burden on the body that heavy metal toxic load. So those are your three main disruptors and disruptors for biofilm.
All right. That's such a cool word, biofilm disruptors. So and they disrupt in such a healthy, nice way. Okay, so we've got a few protocols that we just want to do a quick run through. And then we've got some take-home messages, and we want to talk about then the program after that. And so this is kind of pulling it all together with Candida overgrowth and a lot of the principles that we've talked about already. Generally, a digestive enzyme to make sure that there's a healthy digestive tract. Also, then we've got something called the Canned Fix Kit, and it includes Pleoalb, Probiotic 7-in-1, and Basic Tab. So the Pleoalb is downregulating the Candida into its physiological bud form. The Probiotic 7-in-1 is promoting healthy flora, and the Basic Tab is an acid-base rebalancer. Also, in long-standing cases of Candida, what you want to also think about is adding potentially Pleopef to kind of finish things off. Candida is the deeper, albicans is kind of the more deeper systemic, and the PEF tends to be a little bit more associated with the mouth and vaginal mucosa. So once the deep work's done, to kind of clean things up with the PEF can also be ideal. Also, biofilm, as Angela talked about, this is something that has to be addressed. So serrapeptase, and usually serrapeptase plus chlorella, or nattokinase plus chlorella. And in some cases, you could actually do all three to kind of take care of that biofilm, but also to be addressing the heavy metal detoxing as well. And then if patients are having Herx reactions or a lot of healing crises, then in addition to doing things like making sure their bowels are moving and drinking lots of water and saunas, also the Nessman Detox Kit helps to open up the liver, kidney, and lymphatic detox pathways, and colon cleanse helps to open up the intestinal tract for that route of elimination. With nail fungus, so if somebody's dealing with nail fungus, you want to do all of the above that I just mentioned if you're working kind of deeper systemically, and then you want to add in topical local applications. So you use the Pleoalb drops or Pleoalb ointment directly on the nail or the affected area. And then you also want to use an alkaline bath for hands or feet. And so this is taking baking soda and mixing it with warm water and then soaking the nail, the affected nail or nails daily to change the pH of the surface area. So that's the whole thing. You're kind of destabilizing the fungal organisms so they can't actually thrive and survive. And so if soaking it in warm water doesn't work, you can also make a paste and put it directly onto the nail bed, and then you just let it dry and brush off. And then for vaginal yeast infections, once again, it's that same Candida approach, and then what you do, if it's an acute situation, you add the Pleoalb suppositories vaginally before bed every night for 5 nights, and then every second or third night for another few weeks. If it's more of a chronic problem and not an active infection, then the Pleoalb suppositories instead would be used every third night before bed for 1 month, or basically for 1 box. And then finally, we've got cradle cap and thrush. And so this is where Pleopef all by itself would come into play. So with infants, you are not going to be using all these deeper systemic type of treatments. Most of them are completely not appropriate. However, Pleopef by itself is very appropriate and very safe. And so for thrush, what you would do is 1 drop per year of age, twice daily. So this can be given orally, just right in the mouth, or if the mother's nursing, she can apply it to her nipple before nursing. And that should get things cleared up really nicely. For infants with cradle cap, then you mix a few drops of Pleopef with a few drops of water, and then you kind of brush or comb where the affected area is to loosen up the flakes, and then you just rub the ointment or the drops directly on that area, and then that will naturally just kind of get things cleared up. Okay, so take-home messages.
I said, with everything set together, we're really aiming to rebalance the body's environment, support beneficial Candida, reduce symptoms. So 1, we want to support healthy gut and immunity. 2, repair leaky gut. 3, diet with lots of alkaline food. 4, keep the pH balance, keep that terrain balance. 5, decrease heavy metal and mercury load, address biofilm, replenish healthy intestinal flora, open up those detox pathways, address stresses and the emotions, and last and most importantly, downregulate Candida into its symbiotic beneficial form. That's is that whole take-home message.
Yes. And that is the biological medicine approach. And so you can see it all makes sense, and we're not killing, we're changing and shifting things. And so what we want to do is just take a quick moment to introduce this new Candida program. It's really taking everything that we've talked about tonight and put it all into one package. And so it's this whole idea that we're rebalancing the body's environment, we're supporting beneficial Candida, reducing symptoms, and we're helping address all those other things we talked about, like biofilm and mercury and die-off reactions and detox pathways and diet and such, and helping with all the symptoms as well. And so coming back to those phases that we talked about, we've got phase 1 and then phase 2 and 3. And so the idea with phase 1 is that we're going to be detoxing and opening up the pathways, supporting healthy digestion, and then in phase 2 and 3, reduce, replenish, rebalance, so reducing Candida, mercury, biofilm, replenishing flora, and rebalancing pH levels and helping support a strong immune system. So with this then, what we want to do is just take a moment to review the program, and we're just, like, this is really our introductory kind of talking about this and launching it. We have some really special ways that you're going to be able to actually get this program, and so you can have it all in as phase 1, 2, and 3, and then be able to recommend that for your clients. We're going to have an option where if you don't want to carry a dispensary, that your clients are going to be able to come directly to us as a referral through you, and we would be shipping it directly to them. And so there's a few options that we're going to be able to offer, and it's going to be this complete package of everything that we talked about. With phase 1 then, again, it comes back to detoxing, opening up those detox pathways, liver, kidney, lymphatic, and colon, supporting digestion with the digestive enzyme to help us specifically with those cellulose and pectin and other kind of things that need to be broken down from a Candida perspective. And then if by chance that patient is having any vaginal yeast infection issues, or if they're having any nail fungus, then you can get that addressed into this part of phase 1. And so now I'll get Angela to review phase 2.
Okay, and in phase 2, this is where we actually really start working on the systemic component. That's when we really start addressing that valent form of Candida with the Pleo-Alb drops, and then we introduce the bacterial, so down-regulating and as well as repopulating the microflora and alkalizing the terrain. So we do that all together in phase 2. And again, you're still going to be, there's components of phase 1 that will carry over, but this is where the bulk of the program really takes place, because now you're addressing that systemic Candida overgrowth. And phase 3, last but not least, this is where we start really breaking down everything. So breaking down the biofilm, disrupting it, really helping with the digestive enzyme. And so as Heather stated earlier, this is a really complete program and system that can be done in all 3 phases, or you can break it up in phase 1 and in 2 and 3. And it takes a bit of a load off of you as a practitioner. Again, if you don't want to carry a dispensary, you have the option of that being sent directly to your patient with referral from you. So we're really, really excited to roll out this program and this system, and we're actually going to go into more details with it in a separate video conference to really illustrate everything and the procedures that is going to follow. Thank you for joining us on this Candida, the Art of Fixing Candida from the biological medicine approach. And we really hope that you all were able to gather and get a lot of information out of this, and some new information that you may not have known, and reiterate other things that you do know. And just, we're here to help you, to help your patients be at their optimal, and so they're showing up as their best on purpose self, healthy on purpose self.
Excellent. Thank you. Angela's going to finish up with the questions, and thanks, everybody, for joining in tonight.
All right. So we have a couple of questions that have come through in the chat. Okay. Is kombucha helpful? Okay. So Heather has just let me know that it's not helpful in the beginning. However, it can be helpful later on in the 3rd phase once digestion is working more optimally and you've downregulated and shifted. So I hope that helps. Okay, next question. Is serrapeptase safe for our own mucosa membrane? Absolutely. So serrapeptase is not damaging the mucous membrane. It's draining the mucous membrane. So it is very safe to use, and where it shines and does its work is to actually break down biofilm's membrane. So yeah, it is safe for our own mucosa, just not with ulcers. That's the disclaimer. Okay, so next question for serrapeptase, nattokinase, and chlorella, dosage and use in sequence or at the same time or patient-specific. So there is the Health Canada NHB recommended dosing. However, you can definitely customize dosing specific to your patient. So with nattokinase, the Health Canada dosing is 1 capsule a day, and I found that when you're addressing biofilm and when you're looking at using it with more of a Candida picture, you can do 1 capsule 2 to 3 times a day, depending on how severe, how upregulated the valent form of the biofilm and the Candida is. And for serrapeptase, I believe that dosing is 1 capsule 3 times a day. So again, you can adjust that to your patient-specific picture. And then chlorella, chlorella regular dosing is 3 to 4 tablets 3 to 4 times a day. However, when you're using chlorella for binding, you're going to increase your actual dosing amount. So when it comes to binding, the dosing that we have from Nesman Pharma in Germany is 12 tablets 3 times a day. Again, chlorella is quite a strong binder, so I often will recommend to practitioners to start lower. I will recommend to start with 4 tablets 3 times a day and then work your way up if need be, because it is a strong binder. Okay? All right, so next we have, could you suggest quantities for these 3 products when used in protocol? Heather, I'm not sure, what do you mean by quantities? So the amount of tablets you can use for each one? If you remember in one of the earlier slides, we were talking about when you're using them. So often when you're looking at biofilm, you either are going to do serrapeptase and chlorella or nattokinase and chlorella. It's a lot to do all 3. So I would not recommend that you do all 3 at the same time, serrapeptase, nattokinase, and chlorella. You can break it up in phases. I find that serrapeptase is one that you can always start with. So even in phase 1, even though we're addressing detox mainly, you can actually start serrapeptase in phase 1 as an additional remedy if you want, because again, serrapeptase other mechanism is reducing inflammation and draining the mucous membrane. So if there's any allergy picture that those patients are presenting, absolutely you can do serrapeptase. And then in the later phases, phase 2 and phase 3, you can add nattokinase and chlorella, because the reality is you are going to have to address heavy metal and binding. You are going to have to address breaking up fibrin and really breaking up that biofilm cyst. So nattokinase and chlorella can be added in the later phases. So I hope that answers your question. Okay, and let me scroll down. There's more. Okay, well, next question is there a role for apple cider vinegar? So apple cider vinegar role, how you can insert that into this protocol or this picture is for acid-base balancing and for liver. So you can do that. Heather is off with the service dog. So you can insert this in the morning to help with the liver and for acid-base balancing. So definitely make sure if you're going to use apple cider vinegar, you want to do about 2 tablespoons in hot water, a full cup of hot water plus 2 tablespoons of lemon juice. And if you need be, you can do half a teaspoon to a teaspoon of honey. So mix that together in hot water and then have them drink that in the morning first thing, even before you start with the specific acid-base balance remedy like basic tab or basic powder. So definitely the apple cider vinegar picture can be inserted there. And then on the other side, not related to Candida, apple cider vinegar is really another way with with the lemon juice to help jumpstart the metabolism as well, and helps to bring, it really helps to detox the fat cells as well. Okay, next question. Will all oral issues, mercury load, root canals need to be addressed before Candida treatment can be addressed? You can still do the whole Candida program and treatment, even if you have a patient that still has amalgams. It's just the mobilizing component is really crucial if they have amalgams. So you can still do the binding. You can still use chlorella because chlorella is a binder. However, to help in mobilizing, they will need to address the mercury and the amalgam load. Root canals are okay because you're still going to be binding any sort of debris and metabolic waste that's there, and any sort of free-forming mercury that's part of the root canal. The chlorella is going to bind that. So I hope that answers your question. So the removal of amalgams should be done before the treatment. However, if it's done during treatment, that's okay too. You just are not going to be mobilizing it. So you would forego some of the binding and the mobilization component. You can still do the Candida. You can still use the albicans. You can still do serrapeptase. You can still do each of the phases. You can still detox. You're just not going to be doing the heavy metal component. Okay? Is apple cider vinegar in reducing stress in digestion? Some clients seem to feel better. If they're feeling better, absolutely. Just, again, with apple cider vinegar, make sure if they're having any sort of acid reflux or if they have leaky gut, I don't recommend that you do apple cider vinegar with those clients or those patients. Okay. Okay, please note, I have another practice that please note, kombucha made Candida symptoms go through the roof, symptoms diminished, and then when kombucha was removed from the diet, client with serious Candida load. So with this one, were they doing an elimination diet or like a no sugar diet and then introduce kombucha? Because if that's the case, that would explain why the symptoms of Candida really increase exponentially. So because if you're doing a no sugar diet, Candida is already born into the membrane. The other thing Candida does when you're doing a no sugar diet is it sort of spreads out these roots that that go into the bloodstream because it's searching for sugar. So that's why that whole no sugar diet doesn't really work, because Candida will always seek out sugar. And if it's not readily available in the digestive system, it's going to go into the blood. So that's why Biofilm really recruits fibrin, because it goes right into the blood. Okay. And I believe that is the last of the question. We thank you so much for joining us, and I wish you all a beautiful night. Good night, everybody. Take care, and thank you for joining us. Bye for now.